Okay, so let's talk about fentanyl. You hear that word everywhere, right? On the news, in conversations, and it's always one of two things. Either it's this miracle drug saving someone in a hospital, or it's at the absolute heart of a national tragedy. So what's the real story here? Let's dive into this thing of crazy contradictions and try to understand its two very different faces.
So that's the central mystery we're going to unpack. How in the world can one single drug be both a miracle and a menace, a lifesaver and a killer? Well, to figure that out, we've got to go right back to the beginning and understand what fentanyl actually is.
Okay, so at its core, fentanyl is what's called a synthetic opioid. That just means it's man-made. Now, think of it like a key that fits perfectly into these special locks in our brain, our opioid receptors that control pain and emotion. And it's a uniquely powerful key. Its chemical makeup lets it just zip from your bloodstream into your brain incredibly fast. And when it gets there, it latches onto those receptors with immense strength. This completely blocks pain signals, but it also unleashes this huge flood of dopamine, which creates a really powerful feeling of euphoria.
And that incredible ability to just shut down pain, that is precisely why it was created in the first place. So, let's look at the first side of this double-edged sword, its crucial role as a lifesaver in modern medicine.
You know, this wasn't some accident in a lab. Fentanyl was deliberately designed back in 1959 by a Dr. Paul Janssen for a very specific purpose. By the 60s, it was already being used in operating rooms as an anesthetic, and today, it is still an absolutely critical tool for doctors.
So where is it actually used? Well, only in highly controlled medical settings. We're talking about managing that intense, awful pain you feel right after a major surgery, or providing relief for patients with really severe chronic pain, using these slow-release patches. It's even used to help cancer patients manage these sudden, overwhelming spikes of what they call breakthrough pain. In these situations, it's a genuine miracle.
But that is only half the story. Now we have to pivot to the other, much darker side of fentanyl. How this amazing medical tool morphed into a deadly crisis on the street. And the whole reason for that really comes down to one single terrifying property. Its potency. Fentanyl is, get this, 50 to 100 times more potent than morphine. That extreme strength is what makes it so incredible in medicine, but it's also what makes it catastrophically dangerous outside of a doctor's control.
Let's really put that into perspective, because the numbers are kind of mind-blowing. So, if we say morphine has a strength of 1, heroin is already 2 to 3 times stronger, but then look at fentanyl, it's 50 to 100 times stronger. See, it's not just a step up, it is a massive, exponential leap in power. The human body is just not built to handle that without precise medical supervision.
And to make that abstract number totally concrete, consider this. A lethal dose can be as small as 2 milligrams. That's an amount that literally looks like a few grains of table salt. It just perfectly illustrates the microscopic, almost non-existent margin for error. But here's the thing. The biggest danger isn't that people are out there trying to find pure fentanyl. No, the crisis is fueled by deception and by simple economics. Illicit fentanyl is super cheap to make, and because it's so potent, a tiny, easily smuggled amount can be stretched to make a huge number of street doses. This makes it incredibly profitable for dealers to secretly mix it into other drugs.
And that's the crucial point. It's hiding in plain sight. It's being pressed into counterfeit pills that are made to look exactly like real prescription pills, like oxycodone or Xanax. It's being mixed into heroin, cocaine, even methamphetamine. Someone might think they're taking one thing, but they are unknowingly taking a lethal dose of something else entirely.
So, because of this hidden danger, knowing how to recognize an overdose is more critical than ever before. You see, fentanyl works by depressing the central nervous system, and that includes the body's most basic, automatic drive to breathe. A really simple way to remember the key signs is the acronym BLUE. So B is for breathing that's become slow, shallow, or has stopped altogether. L is for lips and fingernails turning blue or gray from a lack of oxygen. U means the person is unresponsive, you can't wake them up. And E is for extremely small pinpoint pupils. If you see these signs, it is a medical emergency.
But, and this is a big but, there is a way to fight back. There's a way to reverse an overdose, if someone acts fast, with the right tool. Let's look at the problem and the solution side by side.
So the problem is that fentanyl is sitting on the brain's opioid receptors, blocking that signal to breathe. The solution is a medication called naloxone, which you probably heard of by its brand name Narcan.
It works like a chemical crowbar. It literally knocks the fentanyl off of those receptors, which allows the person's body to start breathing again. It's amazing.
Now here's a really critical detail that's directly related to fentanyl's crazy strength. Because it binds so tightly to those receptors in the brain, a single dose of naloxone might not be enough to do the job. It's actually really common for first responders to have to give multiple doses to successfully reverse a fentanyl overdose.
So, what's the bigger picture here? How do we tackle this crisis? Well, it's a strategy called harm reduction, which basically focuses on practical ways to keep people alive. This means getting naloxone into the hands of as many people as possible so life can be saved right there on the spot. It means making fentanyl test strips available so people can check if a substance is contaminated. And maybe most importantly, it means education, making sure everyone, especially young people, understands the immense danger of counterfeit pills.
So we come right back to where we started. Fentanyl is both a powerful medical tool and an incredibly deadly weapon. The only difference is control, context, and knowledge. Understanding that distinction, that this is a tool in one context and a poison in another, is our first and most important line of defense. The final question really is, how will you use this knowledge? How can it be shared to maybe save a life?